one option, it's really recommended for hot flashes, is you could try it at night, as something after dinner, and it may help. It helps a few people every
tea.
night.
So you're talking the loose tea in the
Chamomile.
You can buy it.
Yeah.
It's actually the little white flowers that are chamomile, and there's a tea out there. We don't call it a tea because tea has usually tea in it.
Oh yeah.
But it's more like a herbal tea.
Sure.
So
Gotcha.
and
we
it's
get a
supposed
healthy
to be
living and
very
we go in the
soothing.
bulk.
Yep.
Yeah.
Buy it in bulk.
And we bought the little screen thing to go in the water.
We bought a whole bunch of different teas.
So that's one option,
Okay.
but in some people that doesn't work. And then integrative medicine really recommends acupuncture for it.
Oh, I got a girl lined up.
You can ask her about it, and it works. Patients who have tried it, they
I
say
wish
it
I knew
works.
that. I had it for 20 years.
It works, apparently. You see, I have found out through working with patients and all of that it really, really works. That's why you need to look elsewhere. Because some doctors like to give other pills and other hormones and just make you
compound
toxic.
it, right, yeah.
You want to avoid these types of things.
I agree. So I found it interesting that some days I'll have 4 hot flashes of minor kind of sweating, and other days I've had as many as 20. And the sweat will be coming down for me, and I'm trying to connect the dots as to see what can cause the range of experiences that I'm having. If it's like lack of water or
It's definitely
stress,
dietary and stress and all of that. But one of those, my patient's actually, who's an engineer, and because he's Chinese, knows acupuncture. He was actually trying to explain to me one day the balances that create this, hot flash and then cold sweat and all of these things that happen, and how they can address it through their medicine better than we
Love
can.
it. Love it.
So try it and let me know.
I will do that.
I would not recommend any drugs, even if they tell you. Just don't take drugs.
Yeah, I wouldn't. Yeah, it's such a minor.
It can be disturbing.
Yeah, it's a nuisance.
Yeah.
Waking up in sweat is not fun, but I wouldn't take drugs for it. Cool.
Any other question?
Nope.
No.
I'm good.
I'm gonna go ask Ashley if she has questions because I usually don't cover her detailed. She wants every little nitty. I don't like my doctor doing that to me, actually. So I'm so glad you're doing great.
Thank you very much, and I am doing
And
well.
it's thanks to what you're doing and you're doing. And of course you, because you made it. So
Yeah.
very nice to meet you all. So how come you joined? You just came?
It's her birthday Friday.
Oh.
So she flew in from Florida, and I flew in from New York, and we're all at my brother's house.
Could be the last time you come here.
You never know,
And,
depending on the concerns.
and you're now down to one house, and so you're going to be more focused. So it's
So she brought up something. Should I continue to come?
Whatever you want to do.
Okay.
You need a very hired care type of facility.
Mm.
You need to be, if any of these things may grow, depending on what kind of progression we're looking at, you may need a biopsy. You will need access to big trials.
Mm.
You need all of that.
Mm.
Coming once every 4 months is not a big news. We have a lot of patients from New York, from everywhere who do come. But then again, some people identify physicians that they like and stay with. And
Sure.
when something comes up, then they're like, oh yeah, let me shoot an email, talk about this. Do I need to come, you guys? So it's all about your lifestyle, what you need to do.
So what would we have to see to stop coming every 3 or 4 months?
Oh, in a patient with such a germline mutation,
Yeah.
even if I didn't come every 3 or 4 months here, I would definitely make sure wherever I'm at that they're doing those tests, regardless of his doing them.
He's going to have CAT scans every 3 or 4
Not
months?
yet. If we can get to the MRI, which is my preference,
Yeah,
that would be great.
every 3 or 4 months though.
Gotta stay on it. Gotta stay
There
on it.
are findings there that we're monitoring closely. So I would not give up. If it was me,
Oh, I'm not.
that's what I want to do. I was recently having some tests. We were going back and forth, and there was like, do we need MRIs? But it's nice to have that option to discuss these things. and get that insight. We need to do it every 3 months. Let's be on top of it. Because in a young man with this type of mutation, things can pop up, things can happen. You already started with different expectations from this to be cured, and now we're dealing with chronicity.
Chronicity?
Chronic disease.
Oh, yeah.
It is what it is. You would hope that at the end of the day there would be a way that we could get rid of all of it and revert you to normal. And we are not there yet.
Right.
What we need to do,
Along the way, stay
and I want to
vigilant.
run it by you since we're making some decisions. One good thing that we could also request is from your original specimen, the one you did way before we even met, the original excision of the cancer, that we could do a foundation 1 analysis. Let me tell you which specific specimen. We have it in here. Do you know what foundation 1 is? Have you read it all about it?
Not at all.
Foundation 1 is an FDA cleared test, now recently cleared, to molecularly characterize cancers. We use it for breast cancer, for lung cancer, for a lot of cancers. And it gives you the equivalent of a molecular fingerprint for the type of cancer. There are a lot of tests like that out there. We even have one at MD Anderson, we call it the Oncomine. But that one is FDA cleared.
Got it.
So we could request that analysis to be done officially, and what we would use is, we could do it through this one. This one is actually what I would go for. The 10/25/11.
Wow.
They should have it over at Rochester,
Mm-hmm.
and we can request this
Okay.
to be sent
Oh,
over for analysis.
let's do it.
So they could give us, apart from the BRCA that we know, what other
Sure.
molecules are off.
Mhm.
So you don't have to do anything in the sense, we'll send the order. You will go, and then we will get a report that we will share with you, and you'll probably get that report. That not only says, like, you got a report, oh, BRCA is mutated. It will also say what molecules are found, what type of drugs are available, what type of research in the world is available, anywhere. So that would be an extra tier of information in anticipation of whatever else we may need.
Okay.
So then you can make decisions.
Joe, did you ever tell anyone here that your sister died of inflammatory breast
Yes.
cancer?
This is how we.
Yeah, we found that. And we actually looked at his mutational status before August of 2016, because in August of 2016, a very big publication came out in the New England Journal and convinced more people that prostate cancer is very genetic. It actually showed for the first time that 12% of men who have a disease like yours that goes to outside the prostate may have such mutations like the one we found, irrespective of if they have family. More so if you have family. But remember, they were trying to give us a little bit of a hard time, not enough of family history.
Mm-hmm.
But now we have strong proof that gentlemen like you needed to retest it.
Mm.
So we were a little bit ahead of the game. But there, if you look collectively at the data out there, it suggests that now we have proof that this, what we did, was the right thing to do. Now, you've tested the other family members, right?
We
What's
went.
happening?
No.
You
Yeah.
said you would.
We went. Oh, your sons. We have.
Yeah.
I'm riding them. They haven't done it yet.
You had told me, like, way when we talked
Yeah,
about
I
it,
know.
you were to.
What about your brother?
He
Did
went.
you tell him?
My brother's done. He's
But
he's
they
all set.
didn't do a
No.
PSA,
But is he negative? Or does he have it?
does it?
BRCA2? I don't
Oh,
recall.
he didn't do BRCA. He
No,
didn't do
no.
the analysis. He just
Oh, he
did. He
did.
just went. He hadn't even been checked for his prostate,
He may need to do.
but he
Yes.
did go to the
The
doctor.
decision
for
is
that.
theirs, right? The decision is theirs for the children to. Why? Because there's implications. You might want to even